Over a year since some students have stepped foot in a classroom, and based on this latest announcement, the changes to the school year are not over.
We bring in president of the Robert Wood Johnson Foundation and former acting director of the CDC, Dr. Richard Besser. Good morning.
Good morning. It's nice to be here.
Good to have you with us, Dr. Besser. First, how should students and parents be preparing for the school year? And should districts start mandating vaccines?
Well, I'm a pediatrician and I'm a parent, and I'm very excited that so many students are going to be back in school this year. Clearly, that is the best place for kids in school learning if it can be done safely. And what we found over the past year is that it can be done safely. If teachers and staff get vaccinated, if schools ensure that everyone's wearing a mask and that there's room between desks and that there's some improved ventilation, it can be done very safely. But it's important that parents pay attention to what's going on in their own community. If you're in a community where the rate of disease transmission is very high and the rate of vaccination is very low, you really want to focus very, very clearly on what's going on in the school and that they are ensuring that the measures are in place to keep your children safe.
And Dr. Besser, this question is from a mother with 2 children under the age of 7. She says, how do we protect our kids from this virus with no vaccine, and our school district is not mandating masks in the classroom? How do we keep our families safe?
Well, I hope with the new CDC guidance that more schools will say yes. We are going to mandate that all children wear masks. It's also important to recognize that there are no vaccines for children under 12, and they're protected by what we do as adults. So I vaccinate myself to protect myself from COVID, but also to protect those around me who I care so much about who can't get vaccinated, either because they're too young or they have medical conditions for which the vaccines aren't effective. It's one of those things we do for each other. And I expect that over time, more and more businesses will require vaccination, whether it's requiring that all teachers and staff are vaccinated or whether a business for their employees says we are going to require that everyone is vaccinated in order to keep the entire workforce safe.
Dr. Besser, I know you're a pediatrician and not an attorney, but in your general knowledge, would it be legal for places like school districts to mandate vaccines?
It would. It's important to recognize the CDC is not a regulatory agency. And so while the CDC can recommend different measures, it's left to states and localities to decide on implementation. For vaccine mandates, most states do that at the state level in terms of what vaccines are required. As a pediatrician, I know that it's extremely effective when you require vaccinations for school entry. A lot of parents who may be on the fence about vaccination, once those requirements are in place, say, you know what, I'm just going to go ahead and do it. And I think that would be the case for COVID vaccine if it were required in certain circumstances. But that's not something we're going to be seeing for younger children. I don't expect that we're going to be seeing it at this point for many schools, for high school and middle school students either.
And Dr. Besser, on another note, in a recent article, you mentioned that students should always have free meals. And why is that so important, especially now?
Well, the pandemic and the economic crisis have shined a bright light on conditions in America. And what we see is that it's not equal. There isn't opportunity everywhere. And this school year, what we are seeing put in place is universal school lunches. That means that every child, regardless of income, will get a healthy meal at school each day. And we know that 1 in 6 children in America every day face a situation where they won't know if they're going to be getting enough to eat. This will ensure that every child will. And it takes away that stigma, any sense of shame that a child has in having to step forward and qualify based on income. That's a wonderful thing. And I hope that the changes that are put in place this year become permanent, so that every child has what they need. It's very hard to be in class and focus and learn if your stomach's growling, if you're hungry, if you haven't had enough to eat. This is something that we can put in place to ensure that every child can do their best in school, can go to school with dreams and see those dreams become real.
All right. President of the Robert Wood Johnson Foundation, former acting director of CDC, Dr. Richard Besser. Thank you so much for your time, sir.
Thank you. Take care.